Welcome to Adapt NCLEX. In this video, we're going to talk about maternity, nursing, NCLEX review on second trimester nursing, things that occur in second trimester. We're going to practice question, 10 yield questions using select or apply. All the 10 questions are SATA questions to teach you anticipatory guidelines and help promotion second trimester. Are you ready? Let's get to it. This is the first question. As usual, you know the drill. You stop the video, answer the question, use your own answers to keep track of your record. Then you listen to me the way I approach is. They are all select or apply SATA questions on the NCLEX using maternity second trimester nursing. What do you think? Select or apply. You don't have to pick everything. What is the question? Is being asked. Which recommendation are appropriate? Appropriate recommendation. And then she's teaching the client about what? Nutrition during second trimester. Those are your buzzwords. Underline them. Nutrition, second trimester, select or apply, recommended, that is appropriate. I've summarized the question in my brain, telling me key things I need to follow up. I don't have to pick everything because this is next generation NCLEX. Therefore, what? Decrease protein intake, increase iron intake, add salt fish to your what? Diet. Increase your calorie intake by what? 1,000 calories per day. And then limit folic acid supplementation. Pick your answer, select or apply, don't over-select. Next generation NGN questions, they may give you a bunch of answers. There may be only one answer, two answers. What do you think? Go back to the buzzword. Second trimester, nutrition, appropriate. You pick your answer? I know you pick it. But I can tell you the right answer is what? Iron supplement. Increase your iron intake. Why? That's what you need to prevent anemia. Also will help with the baby. Protein should be increased. We need protein for synthesis as the baby grows. Salt fish has a lot of mercury. You should avoid it. Increased calorie intake is good, but not 1,000. You need to increase 350 at the second trimester. In the third trimester, increase it 450. If you increase it more than what you needed, you get a microsomia baby. You develop diabetes and other complications associated with this. Therefore, 1,000 is too much. Limit folic acid. You need folic acid to prevent what? Neurotube defect. Therefore, only one answer. Select or apply. Don't over-select. If you over-select, you lose point. Now, B is the only answer. And this is the explanation giving you Adapt NCLEX Bank. This is where I get most of my questions from. If you need more, subscribe to Adapt NCLEX on demand. Check my YouTube channel. You see the link for that. Next question. Which action should the nurse take? Need to take certain action. Select or apply. A nurse is preparing to perform Leopold maneuver on a client who is what? 26 weeks. Which action should the nurse take? Ask the client to empty her bladder. Position the client upright with knees what? Flexed. Use ultrasound gel. Place palpate the back symmetrically. Apply external fetal monitor first. What do you think? What is the key aspect of here? Stop the video, analyze the question, and then perform your answer. The key word I can tell you in the question is a Leopold maneuver. And when you perform a Leopold, we have a select or apply. You have to understand what is Leopold maneuver. It's designed to what? Reposition the baby based on their location, and we want to put their head down depending on what they look like. Therefore, what do you think? Of course, we got to let them empty their bladder. You cannot reposition the baby if the mommy is upright. This was a trap. The knee is flexed, but the mommy should be supine. You don't need to use ultrasound. You just basically maneuvering the baby. You can feel the baby. You don't have to use ultrasound to do anything. Why do you need an ultrasound gel? It's a trap. Palpate the back symmetrically. What? The mommy is supposed to palpate the abdomen. You can feel the baby in the abdomen. So you palpate, not the back. You don't need the external monitor to do that. There's no monitoring regarding Leopold maneuver. Therefore, only one answer choice. Like I said, these questions are selected to test your knowledge about select or apply and think about it. There may be one or two answers there, but you got to use the concept to answer the question. Which finding require further evaluation? Select or apply. And next is assessing a client 24 weeks gestation. Which finding further require evaluation because it's a problem? Persistent unilateral leg pain. Blood glucose screening scheduled. Fundal height is about 24 centimeters. Sudden painless vaginal bleeding. Mild ankle edema at the end of the day. This is where you got to apply your B-sharp. Unexpected finding or it's not expected. If it's expected, move on. If you think it needs to be intervened, then select it. What do you think? Stop the video, pick your answer. I can tell you, if you have unilateral leg pain, it may be DVT. We got to figure out. Persistent, it's not going away. Blood glucose screening schedule. Yeah, that's the time they schedule blood glucose, 24 to 28 weeks. That's when they schedule it. This is acceptable. Fundal height is 24 centimeters. It corresponds to the week of gestation. We don't need to intervene. Sudden painless vaginal bleeding. That's a bad problem. It can be previous. We don't like it. If you have edema, if you have mild ankle edema at the end of the day, think about it. It's an unexpected finding. We don't need to do anything. Therefore, those are our answers. NS is caring for a client at 28 weeks gestation who report lower abdominal discomfort, which findings are consistent with normal second trimester discomfort. There will be some pain during the second trimester. Which of these do you think is normal? This is where the NCLEX will trap you. If you have problem with this particular question, I want you to watch it multiple times. This is the areas they trap people. Pain, unexpected finding pain, and unexpected, because you think you got to do something. They complain about discomfort. Sharp lower abdominal pain that occurs with what? Sudden movement and resolve with rest. There's a nasal congestion without fever. There's burning sensation in the chest when you eat. There's a severe constant right lower quadrant pain with rebound tenderness. There's intermittent leg cramp at night. There's a vaginal bleeding with abdominal pain. Which of these discomfort during second trimester do you think you have to intervene and do something? Keep track of your record. Stop the video. Pick your answer. I want you to get 10 out of 10. Second trimester. We're mastering maternity, nursing, NCLEX review. At the same time, we're reviewing NCLEX, and we're using select or apply, NCLEX practice question, NCLEX review questions to answer this question. Therefore, what do you think? This is a round ligament pain. Sharp lower abdominal pain that occur with sudden movement and resolve. It's an expected finding. This is round ligament, expected. If you have nasal congestion and there's no fever, you don't have sinusitis, right? Burning sensation in the chest after you eat, that's a reflux, expected finding. If you have severe right lower quadrant pain with rebound, this may be appendicitis. You can have intermittent leg pain when you sleep. That's not a problem. It's not DVT. Vaginal bleeding with abdominal pain, that may be abruption. And therefore, we should do something about it. That's a bad problem. Therefore, those are your right answers. NS is caring for a client at 22-week gestation who report dizziness when what? Laying flat. Which nursing action are appropriate? The patient said, when I lay flat, I become dizzy. Which one is appropriate? Assist the client to left lateral position. Place the pillow under the right hip. Administer oxygen immediately. Educate about Vena Cava compression. Encourage supine sleeping. Stop the video. Pick your answer. These are straightforward questions, but select to apply. There's trap answers. If you overselect, you lose point. That was the purpose of this exercise, to teach you how to do select or apply. There will be answers that may be partially correct, and you overselect. Go for the bars with 22 weeks. He said, what? I feel dizzy when I lay flat. That tell you, pregnant lady, you should not lay flat. From there, why would you tell them to remain supine? You know that's not appropriate. You can put them on the left side, lateral position. You put a pillow on their side to support them. Oxygen is okay, but immediately, is that the problem? You see the trap? If you pick, say, I trap you, because you know oxygen is always good, but he's not answering the question. He said, I'm pretty dizzy when I lay flat. Then you're going to slam oxygen on them. It's not going to help them. That's not immediately, unless I tell you there's desaturation. Yeah. Said, I feel dizzy. You know it's blood pressure problem, not oxygen problem. Therefore, don't pick this. And then educate them on vena cava compression. That's what is causing the problem. When you lay supine, you causes vena cava compression. Don't pick number 3. If you do that, I trap you. It's a strategy. Don't pick it. And then she's teaching about danger signs during the second trimester. Which client statement indicate correct understanding? Danger sign during the second trimester. Correct understanding. I should report decreased fetal movement. My back pain is normal. I will report severe headaches. Swelling in my face is normal. I will call if I have vaginal bleeding. Which teaching, anticipatory guideline, promotion, teaching you can provide them. In second trimester, they should indicate correct understanding that what they're telling you, this is expected. Pick your answer. Fetal movement, you got to report. If there's no movement, let me know about it. My back pain is an expected finding, nothing to worry about. If you have severe headache, I want to know that you don't have preeclampsia. Your face swelling may be associated with preeclampsia. Call if I have vaginal bleeding. Yeah, you may be having previa, you may having abruption. All this can be bad. Therefore, I should report decreased fetal movement. It's a good thing. Correct understanding. My back pain is normal, right? If you have small back pain, it may be normal. I will report severe headache. You should let me know. Your face when it's swell, it's not good. Preeclampsia. I will call if I have vaginal bleeding. Those are all good signs. And this is assessing a 19 weeks gestation. Which finding I expected? Which of these do you think I should see in a 19 weeks pregnant patient? Linear Niagara, Colostrum, decreased urine frequency, positive Chadwick, cervical dilation, positive Leyden sign. Which signs you think is acceptable and is normal, is expected in a 19-week-old? Let me know what you think. Pick your answer. Stop the video. I want you to get this answer right. What do you think? What do you think? I can tell you, linear Niagara is normal. It's due to what? Melanin deposition, mostly on the abdomen. Colostrum is the marks of pregnancy, steroid problem. As the uterus go up during the second trimester, your urine frequency decreases. It increases during the third trimester. Chadwick signs, vagina bluish discoloration. Yeah, excellent. Cervical dilation. I don't want you to dilate. I don't want you going to get preterm labor. Then positive Leyden sign is the anterior portion of the the uterus. This is usually early signs of what is a probable sign. Early sign you see is during the first trimester, not the second trimester. So A, B, C, D are your right answer. It may be a hard question, but I want you to know, I want you to master them. These are second trimester things. If you know, maternity nursing will be easy. NCLEX review laboratory tests for a client at 25-week gestation. Which tests are typically performed during the second trimester? Select or apply. 1 hour glucose test, maternal serum alpha fetoprotein, group B strep screening, quad screen, and amniocentesis. Which of this is typically performed during the second trimester, 25 weeks? What do you think? If you don't know any of them, don't pick it. If you recognize them and you understand them, pick it. Don't guess, because then you lose more points. Pick those that you know you're 100% confident. I can tell you glucose tolerance test is done 24 to 28 weeks. The patient's 25 weeks. That's good. Maternal alpha-fetoprotein is done during the second trimester. Good B strep is done the end of third trimester when you're about to deliver to make sure you don't have infection. Quad screen and amniocentesis, as indicated, will be done. So those are all right answers. 9. And nurse is teaching the client 18 weeks about physical changes in second trimester. Like I told you, these are little things NCLEX will put there, selected apply, everything. When they give you this one, they want you to know if you remember it's going to be a selected apply, SATA question, maternity nursing, NCLEX review question. Colostrum may begin to be formed because you're in second trimester. Your blood pressure may slightly decrease. What do you think? Braxton Hicks contraction may occur. Fetal heart tone are detected by Doppler. Your weight gain should stop during this trimester. What do you think? Second trimester pregnancy. These are clues that are telling you the certain things you have to know, normal things. Stop the video, pick your answer, let me know. Colostrum may be begin to form at that time. That's good. Blood pressure slightly will decrease. And the Braxton Hicks contraction may occur. That's normal. Your fetal heart tone can be detected throughout. Your weight gain does not stop. It continues to increase. But these are little things I want you to know that. I mean, these are very, very important. As your blood pressure decreases, it's a sign when it increases, we get into trouble because we know you are preeclampsia. Because of vasodilation, the blood pressure goes down. That's the one that may trap you. Everybody expects your blood pressure to go up. It goes down. And then, therefore, if we see that it's going up, we know you may be having preeclampsia because of vasodilation. And then she's caring for a client who is 20 weeks pregnant. Which finding I expected during the second trimester? Select or apply. Second trimester, which one is expected? Quickening, increased vaginal discharge, Hyperemesis gravidarum, fundus is the level of the umbilicus, and supine hypotensive syndrome. Which of these are all expected during the second trimester? This is the last question. I hope you get 10 out of 10, but this will help you get a 10 out of 10. So stop the video, pick your answer, let me know. Quickening, you can start as early as like 12 weeks, so that's good. You're going to have vaginal discharge. But remember, Hyperemesis gravidarum usually should stop by the first trimester. Second trimester, we shouldn't see it, but if it does, then you have a problem. Fundus at the level of the umbilicus because you have 20 weeks. That's the level of the umbilicus. And hypotension, if you lay on your flat, your blood pressure is going to go down. This is that. 10 questions, NCLEX practice questions, maternity nursing, select or apply on second trimester nursing. Thank you for watching. If this video helped you, I'm going to link another video on select or apply on pregnancy, labor and delivery. Watch it, and this will consolidate everything for you. Thank you very much for watching. Thank you.